Affordability involves keeping CareShield Life premiums affordably priced, whilst at the same time also providing premium assistance to those Singaporeans who need it. There are several points. First, to ensure that CareShield Life premiums remain affordable, the ElderShield Review Committee had recommended that the CareShield Life scheme focus on providing basic coverage for Singaporeans' long-term care needs. One of the recommendations was to keep the existing ElderShield claim criteria, which is the inability to perform at least 3 out of 6 activities of daily living, ADLs, a point that we had heard many members touch on earlier. Ms. Ong in particular asked if CareShield Life payouts could be tiered based on the extent of disability. We have previously considered this, and I think Ms. Ong would also know that lowering the claims criteria to 2 ADLs would immediately increase the CareShield Life premiums for a 30-year-old policyholder by about 1/3. That's anything in the order of 25% to 1/3, 33% of increment just by dropping down to 2 ADLs. The premium increase for CareShield Life would likely be significantly and also exponentially higher if the claims criteria is then further lowered to 1 ADL, given the high incidence and length of disability. So not only will there be more persons with 1 or 2 ADLs as opposed to 3, but the period of support, which is for life, will also be for longer. So both will have an impact on the amount of premium that will have to be collected. The committee had also recommended that CareShield Life payouts start at $600 per month and increase over time. Dr. Neo asked, and I think many others as well, such as Mr. Chen Shumao, if the payouts could be higher. CareShield Life payouts already start at an amount which is at present significantly higher than the current ElderShield scheme. Increasing the starting payouts from 600 to say 800 a month would also increase premiums for a 30-year-old policyholder by around 1/3. So recall I said at the start that we have to find a design architecture for this scheme that is affordable and that meets the interests of basic long-term care interests of Singaporeans. In addition, as members would know, CareShield Life payouts are set to increase at 2% per year for the first 5 years of scheme implementation, assuming a continued increase of 2% per year after that. So that's 2% thereafter, after the 5 years. A 30-year-old joining the scheme in 2020 may receive around $1,002 per month should he become severely disabled at age 67 or later. So that's the projection that we take into account, and also to keep up with the value of money over time. So for those reasons, we have kept the focus on basic long-term care needs and looked at other ways to provide additional support. And I urge members to remember that the payout from CareShield Life is intended and it is designed to be complementary. It complements the other pillars of financing support, not replace and not take over, and also not put in place and reduce others. It's to complement as an add-on. Lower and middle-income Singaporeans, including those with moderate disabilities, will be supported with subsidies of up to 80% for residential and non-residential care services and can also receive other disability grants.